पूज्याचार्य देव श्री पद्म सागर श्री जी महाराज की निश्रा में जब हमारा चातुर्मास और उस वक्त हमारा मंथन चलता रहता था, मात्र आध्यात्मिक ही नहीं, समाज, देश और दुनिया हर किसी के लिए हमारे अतीत, हमारे वर्तमान और हमारे भविष्य, अतीत बड़ा ही सुनहरा, उतार चढ़ाव हर तरह से आए, लेकिन महाजन परंपरा से चले आ रहे हम, स्व पर हर एक के हित के लिए हमारा अस्तित्व रहा, जगत वंदनीय रहा यह समाज, सर्वत्र सम्माननीय रहा यह समाज। और जब उसकी वर्तमान दशा को देखते थे तो दिल कसक उठता था कि अभी भी सामर्थ्य तो असीम है, लेकिन जिसका अभाव है वह है एकता। बचपन में आप सभी ने पढ़ी होगी वह कहानी कि एक टहनी और एक गठरी। टहनी हर कोई तोड़ सकता है, लकड़ी की गठरी को कोई नहीं तोड़ सकता। उसका सामर्थ्य उसके कुल योग से कई गुना ज्यादा हो जाता है। समाज में जब हम विच्छिन्न थे, नाहक छोटे छोटे मामलों को लेकर के हम रुझे हुए हैं, वहां पर हमारे सामने रही हुई संभावनाएं हम नहीं देख पाए, यह हमारी मूर्खता होगी। हमारे पुरखों ने तो, हमारे आचार्यों ने तो, हमारे तीर्थंकरों ने हमें असीम ज्ञान दिया है, असीम समझदारी दी है। यदि हम उसका उपयोग नहीं करते तो यह हमारा दुर्भाग्य होगा। वहीं से यात्रा चली, किसी संप्रदाय के भेदभाव को रखे बिना सभी को साथ लेते हुए, हाँ, हर कोई अपनी अपनी सांप्रदायिक मर्यादा, अपनी आराधना को भले करे, लेकिन जहां पे भगवान महावीर का नाम आए वहां हम सब एक रहे। इस आशय से समाज के जो शक्ति पुंज थे, जो सामर्थ्य पुंज थे, इन सभी को जगह जगह करके एकत्रित करने का जो महाअभियान प्रारंभ हुआ, और उसमें मैं खास कहूंगा कि मेरे साथी मुनि नर पद्म सागर जी ने जो दिल जान एक करके इस अभियान को दिशा दी है। आज कई कीर्ति स्तंभ इसके स्थापित हो चुके, और उसमें यह एक श्रेष्ठतम कीर्ति स्तंभ है। आज का यह प्रसंग ऑल इंडिया जैन मेडिकल स्टूडेंट्स कॉन्फ्रेंस, और वाकई में अभिभूत हो जाते हैं यहाँ की उपस्थिति देखकर। कहां से भावी सितारे, उदीयमान सितारे यहाँ पे एकत्रित हुए हैं। हमें बड़ा ही विश्वास होता है कि निश्चित ही इस समाज, इस देश और दुनिया का भविष्य उज्ज्वल भी है। अभी थोड़ी देर पहले जो आप लोगों ने फिल्म देखी, हतप्रभ करने वाली थी। जो कुछ हुआ उसमें से कुछ तो कुदरत का किया था और शेष आदमी का किया हुआ था। आदमी जो करता है वो साधनों से करता है, लेकिन प्रेरणा मिलती है उसके भीतरी चित्त में से। यदि चित्त में हिंसा बसी हुई है, अहिंसा के काम, परोपकार के काम वहां से संभव नहीं हो सकती। अहिंसा परमो धर्म का मंत्र मात्र सिद्धांतों में नहीं, व्यवहार में भी तीर्थंकर परमात्माओं ने दिया। जिन शासन के एक से एक महान आचार्यों ने इस परंपरा को आज तक हमारे तक पहुंचाया है। और कोई कहता है कि अहिंसा की जो हकीकत में बात करने के लिए कोई लायक है तो मात्र और मात्र जैन समाज है। बाकी बात कोई कर ले, जीवन में अहिंसा को जी के बता दे, ऐसे कोई नहीं है। जो व्यक्ति जितना समर्थ होता है, कुदरत का एक नियम है कि उसकी जिम्मेदारी भी उतनी बड़ी स्वतः ही होती है। आप खाली समर्थ हो गए, सक्षम हो गए, और कोई यह विचारे कि नहीं मेरी कोई जिम्मेदारियां नहीं है, वह कुदरत का गुनहगार है। मैं आज समर्थ लोगों के समक्ष मेरा वक्तव्य दे रहा हूं। यह प्रेरणा मैं समर्थ लोगों को दे रहा हूं कि हम हमारे अपने अस्तित्व को भी पहचाने, हमारे सामर्थ्य को भी पहचाने और हमारा योगदान श्रेष्ठतम कक्षा में जाकर के दें। यह धर्म मात्र धर्म भी नहीं है, फिलोसॉफी भी है, विज्ञान भी है। पाश्चात्य जगत में फिलोसॉफी कुछ अलग चीज हुआ करती है और धर्म कुछ अलग चीज हुआ करती है, लेकिन जैन धर्म एक बहुत स्ट्रांग साइंटिफिक फिलोसॉफिकल बेस पर रहा हुआ, बहुत ही प्रैक्टिकल आचार, एक जीवन शैली को बताने वाला धर्म है कि वहां पे परस्परोपग्रहो जीवानाम, हम खुद भी जो है आनंद में रहे और औरों को भी आनंद में रहने के लिए मदद रूप बने, हम खुद भी जिए और औरों को भी जीने के लिए मदद रूप बने। यह हमारा परस्पर सह अस्तित्व का सिद्धांत है। आज विज्ञान जगत में अनेक तरह की शोध हो रही है। आप तो मेडिकल स्टूडेंट हो, ह्यूमन जीनोम के बारे में आप पढ़ रहे होंगे। पूरा ही अपना जीनोम रिकॉर्ड कर दिया गया। ह्यूमन ब्रेन मैपिंग का एक जॉइंट एफर्ट चल रहा, अपने मस्तिष्क की गूढ़तम बातें लेटेस्ट इक्विपमेंट की सहायता से जानने का प्रयास किया जा रहा। आज भौतिक फिजिक्स के जगत में अणु परमाणुओं की गहन बातें, आश्चर्य करने वाली एक के बाद एक जो है उसकी शोध हो रही। और जो जो उस विज्ञान के बारे में पढ़ते हैं, शायद आपने धर्म सिद्धांतों को कितना पढ़ा है पता नहीं, लेकिन हम तो दोनों ही पढ़ रहे हैं, इसलिए हमें पता है कि हमें कहीं का आश्चर्य नहीं होता है। सब जानी पहचानी बातें लगती है। ह्यूमन जीनोम की बात करते हैं, हमें 8 कर्मों में से जो नाम कर्म है उसका एक छोटा सा ये सेगमेंट दिखता है। हाँ कि सही बात है कि कोई आदमी काला, कोई आदमी गोरा, कोई चिंगना, कोई किसी को क्यों कैसा ही शरीर मिला। जब नाम कर्म को हम पढ़ते हैं तो हमें बड़ा एक पॉइंट जो है बताया जाता है। और जब हमने ह्यूमन जीनोम को पढ़ा तो हमें कहीं आश्चर्य नहीं हुआ कि हाँ एक छोटा सेगमेंट है। ह्यूमन ब्रेन मैपिंग के विषय में जब हमने पढ़ा तो भी हमें कोई आश्चर्य नहीं हुआ, बल्कि आनंद हुआ कि जिन शासन में बताए हुए, परमात्मा ने बताए हुए एक एक सिद्धांत कितने सही है। हमारी क्षमताएं नहीं थी इसलिए हमने शंका कर दी, लेकिन आज विज्ञान लेशिया को कहा कि यह एक द्रव्य पदार्थ है। ह्यूमन ब्रेन मैपिंग भी जो ब्रेन केमिकल्स को कि अपने बिहेवियर को कैसे जो है वो जज कर रहे हैं, जो न्यूरॉन्स वगैरह बता रहे हैं। भले शब्दावली अलग है, प्रेजेंटेशन अलग है, लेकिन तत्व से बात में कहीं फर्क नहीं है। इस विज्ञान के पास कोई विवेक नहीं है, कोई श्रेष्ठ ध्येय संपूर्णता से नहीं है। जिन शासन के पास श्रेष्ठ ध्येय है और विवेक भी पराकाष्ठा का है। आप विज्ञान ही मात्र न पढ़े, अपनी धरोहर को भी जाने और अपने ध्येय को पहचाने। हम खूब खूब आशीर्वाद दे रहे हैं इस भगीरथ कार्य में सभी शरीक होने वाले आप भावी उदीयमान सितारों को कि आप ऐसे श्रेष्ठ कार्य करें कि आने वाला जमाना आपको कोटि कोटि दुआएं दे। और आप जिनकी बदौलत इकट्ठे हुए हैं, हमने जिनकी मेहनत को करीब से देखा है, जेडीएफ मुंबई के पदाधिकारीगण, केपी जैन, भरत परमार और राष्ट्रीय समिति के बेगानी जी और भी जो विद्यार्थीगण जो आकर के घंटों घंटों जो मेहनत करते थे, पर्दे के पीछे का माहौल, आज आप पर्दे के आगे का शो देख रहे हो और हमने पर्दे के पीछे का भी शो करीब से देखा है। जितने आशीर्वाद दे, जितनी शुभकामनाएं करे, जितनी शुभेच्छाएं करे उतनी कम है। बस यह प्रवृत्ति अपनी सार्थक दिशा में निरंतर आगे बढ़ती रहे, इसीलिए हमारे शुभ आशीर्वाद, शुभकामनाएं।
परम पूज्य मुनि श्री अजय सागर जी महाराज साहब के आशीर्वचन के लिए मैं उनके चरणों में कोटि कोटि वंदना अर्पण करता हूं। कार्यक्रम को आगे बढ़ाने के लिए मैं निवेदन करूंगा कि डॉक्टर केवल जैन आगे का संचालन करें। फेलिसिटेशन करना चाहते हैं हम हमारे जो गणमान्य अतिथिगण यहां पर आए हुए हैं।
फ्रेंड्स, जैसा कि हम पहले ही बता चुके हैं कि इस कॉन्फ्रेंस के सक्सेस के लिए और पिछले भी जितने अच्छे कार्य हम करते आ रहे हैं उसके सक्सेसफुल के लिए हमारे कई दानदाताओं ने और वेल विशर्स और सपोर्टर्स ने काफी हमें मदद की थी और आज हम उनका सम्मान करना चाहेंगे। सर्वप्रथम हम सम्मान करना चाहेंगे हमारे आज के मेन स्पॉन्सर केवल चंद जी का। आई रिक्वेस्ट भरत भाई, रिक्वेस्ट Dr. Jivraj, our founder president, to honor Keval Chand ji Jain from the Keeler ji. Mami go, Santaven. Bharat, please. You go down. Here. Smoke Sripal, please come here. नवीन चंद्र मेहता फ्रॉम डी नवीन चंद्र एंड कंपनी हमारे पड़ोसी भी है और जब भी फोन करते हैं बोलते बस आप हुक्म कीजिए, क्या अच्छा काम करना है, मैं आपके साथ हूँ। मैं रिक्वेस्ट करूंगा हमारे नेशनल प्रेसिडेंट बेगानी जी प्लीज एक मिनट नवीन भाई का आप ऑनरिंग करेंगे। प्रकाश जी नहीं है अभी तक। और ख्याली भाई ताते जेडीकॉन 2005 जब हमने की थी तो 13 भवन कांदीवली में उस कॉन्फ्रेंस को ऑर्गेनाइज करने के लिए ख्याली भाई ने हमें इतनी मदद की थी कि अगर वो मदद नहीं करते तो शायद वो हमारी कॉन्फ्रेंस नहीं हो पाती थी। और आज भी बहुत अच्छे दिल से उन्होंने हमारी मदद की है। मैं रिक्वेस्ट करूंगा हमारे जेडीएफ मूवमेंट के प्रेसिडेंट ऑनर क्वालिफाइड पीएल चौहान साहब भी आगे आएंगे, उनको ज्वाइन करेंगे इस ऑनरिंग में। Friends, let us do fast because we are already running late. We have to switch over to our scientific part fast. Please, Bharat bhai, आइए। ख्याली भाई के हाथों से हम नेशनल जैन डॉक्टर फेडरेशन के सोविनर सोविनर ऑफ द JAIMSC 2005 will be released by Sri ख्याली भाई।
अतिथिगण हैं उनके लिए कहना चाहूंगा कि पर्वतों से कह दो कि उनकी ऊंचाई और ऊंची कर दे, पर्वतों से कह दो कि उनकी ऊंचाई और ऊंची कर दे। बहुत ही तेजी से उड़ते हैं ये, कैंचियां क्या इनके परों को काटेंगी। कैंचियां जिंदगी की दिक्कतें होती हैं, कैंचियां क्या इनके परों को काटेंगी। जनाब, ये परों से नहीं, हौसलों से उड़ते हैं।
Friends, now I'll request केवल जी, चंद्रकांत गांधी ने वो रिक्वेस्ट करी, प्लीज यहाँ आइए। और हमारे नेशनल जैन डॉक्टर फेडरेशन का जो बुलेटिन है, जो संजय छाजे जी, विपिन भाई, प्रवीण भाई, पंकज मेडल प्रवीण भाई, एक मिनट, पंकज मेडल प्रवीण भाई, एमना हाथ है, विपिन भाई, प्रवीण भाई। तो ये बुलेटिन जो हमारे पीआरओ, नेशनल पीआरओ संजय छाजे जी ने रिलीज किया है, उसमें दिल्ली कॉन्फ्रेंस के बारे में जो अभी कॉन्फ्रेंस होने जा रही है, कुचरिया जी यहाँ आए हुए हैं, वो भी आपको ये डिटेल बताएंगे थोड़ी देर बाद में, तो उसका भी डिटेल्स दिया हुआ है। प्लीज रिलीज द बुलेटिन। Okay, friends. And now we will be heading to the session 1. We will be taking few minutes, पर उस few minutes में आपको ऐसे ही नहीं बैठने देंगे. Please, I request all of you to come in the first row. I request my friends, please. One minute. We will be rearranging the stage for 2 minutes, and till that time, one of the outstanding personality will be in front of you. I will not say anything. Over to Dilip.
युवाओं की ये कॉन्फ्रेंस है, 10 साल से भी छोटी उम्र के बच्चे हैं, इनके बारे में मैं आपको कुछ बताना चाहूंगा। जब ये 3 साल के थे तब इन्होंने स्केचेस बनाना शुरू किया। दुनिया में जो भी जानी मानी हस्तियां हैं उनके ये स्केचेस बनाते हैं, बखूबी बनाते हैं। इनकी एक किताब भी है जो इन्होंने यहां पर दी है, तकरीबन 350 स्केचेस इन्होंने बनाए हैं। अगर आपको मैं मराठी में कहना चाहूं तो मूर्ति लहानपण कीर्ति महान। तो इस तरह से हिमालय अपनी कला का हुनर आपके सामने यहां पर दिखाने वाले हैं, जितनी वक्त तक यहां पर अरेंजमेंट हो जाए। और एक खास बात आपको मैं बताना चाहता हूं, इन्होंने गिनीज वर्ल्ड बुक के लिए भी अप्लाई कर दिया, रिकॉर्ड के लिए। वो लोग सोच रहे हैं इसके बारे में, जब तक वो सोचे तब तक आप इनकी कला देखें। धीरे उभर रही है। हाँ, आप तो जानते ही हैं कि एक कलाकार को जब ये आवाज सुनाई देती है तो उसकी कला और निखर जाती है। हिमालय अपनी नाम ही की तरह, हिमालय की तरह ऊंचा, कद में नहीं लेकिन अपनी जो करनी है उसमें कितना ऊंचा है, ये तस्वीर आप ही के सामने इन्होंने निकाली है। एक बार और तालियों की गूंज। मैं निवेदन करूंगा डॉक्टर भरत परमार से कि हिमालय का यहां पर एक ट्रॉफी देकर सम्मान, इनाम भी आ रहा है आपके लिए। डॉक्टर सुधा शाह की तरफ से ये 500 रुपए का इनाम है हिमालय के लिए। तस्वीर हम आपको नहीं ले जाने देंगे।
और ये आप जो स्टेज का सेटअप डेकोरेशन दिख रहे हैं, इनके पिताजी मिस्टर पाटकर ने पूरा स्टेज का डिजाइन और सेटअप किया। मिस्टर पाटकर क्यों डिजाइन। और दोस्तों अभी साइंटिफिक सेशन की शुरुआत हो रही है। मैं आमंत्रित कर रहा हूँ डॉक्टर निकिता वोरा और डॉक्टर मनीष शाह को कि स्टेज पे आइए और साइंटिफिक कमेटी का कार्यभार संभालिए। हाँ बेसिए Dr. Nikita Vora, very young, enthusiastic doctor from Jain Hospital, and she has taken over the scientific committee chairperson, along with Dr. Sujal, our senior advisor. Unfortunately, he is busy with some emergency, so Dr. Manisha is going to do locum for Dr. Sujal Shah, the better half of Dr. Sujal Shah. Very devoted couple, involved in a lot of activities, and especially with Veyavaj at Paritna. This year and every year they are doing medical camps and cataract surgery. With this, I present Dr. Manisha Shah and Dr. Nikita Vora to conduct this scientific session.
Jai Jain, without this, I go to all the people present here for 10 minutes of attention. A very good morning to all the delegates who have taken pains and come for this conference from the different parts of the country. On behalf of the organizing committee of JMS for 2005, I welcome you all to the city of Mumbai and to this very unique conference. Dear friends, this conference is one of its kind. The purpose of this conference is not just bringing us together, on one platform or try to unite all the pathies of medicine. The purpose here is to help us nurture our future. Tomorrow, we should all join the rich lineage of physicians and surgeons. We all have certain goals to be achieved and dreams to be fulfilled. The journey has begun. We all face difficulties and obstacles on the way. This is the time when we define our professional ethics. When stress is high, ethics may get compromised. Will it not be nice if we have some of our own people to help us? Will it not be nice if we have some of our own people to help us, to guide us when we are traveling through the most crucial and the most competitive phases of our career, so that our journey is smooth and uneventful, so that we maintain the high profile of being ethical professionals which befits a proud Jain. JMSC is a sincere attempt to achieve a better future, a better doctor, and above all, a better person. Of course, not all can be achieved or solved in a day, but I assure you, we'll make a very positive beginning today. With this in mind, let us now begin with the session. Our organizing committee has set up a very nice program for you. In the morning, we shall have talks by eminent speakers on various topics ranging from communication skills to medical ethics, from computers in medicine to scientific basis of Jain philosophy. Lastly, we shall de-stress ourselves by blessings from Puja Nai Padma Sagarji before we break for lunch. In the afternoon session, we'll begin by acknowledging and felicitating the meritorious students amongst us. We then have two very interesting panel discussions coming your way, which are specially designed to be interactive and relevant to the needs of the students. We would like to encourage maximum participation from your part. Any queries should be kindly written on a piece of paper and forwarded to the dais by volunteers. To maintain the decorum of the hall, this is required. May I request all the speakers and the panelists to adhere to the time allotted to them for the benefit of the delegates. I am sure you will enjoy attending this conference as much as we did organizing it. Without any delay in the session, I now hand over the mic to Dr. Dilip Jain. You've already heard him. Though a medical by profession, Dilip is a radio jockey. He aired very famous programs on Red FM by the name Chalo Mumbai and
शर्मा जी से पूछो. बहुत बहुत शुक्रिया. बहुत ज़्यादा important नहीं है, but the scientific session is really important, and I'll request all the students to pay attention. I'll call upon the name of speakers one by one, और उनके बारे में ज़्यादा जानकारी यहीं से आपको पता चलेंगी. सबसे पहले I would like to call upon Dr. Chetan Bhatt, a well-known gastroenterologist from Mumbai. A big round of applause for him.
Dr. Jain has been gastroenterologist in practice in South Mumbai. He has trained from GMC and JJ Hospital. Followed by several years as a lecturer at the KEMH. He loves teaching medicine to final year MBBS students and has a unique way of doing it. It is a pleasure to have you, sir. Dr. Chetan.
Thank you, friends. At the outset, I must thank JMSC and All India Jain Medical Students Conference and the organizers of this conference and dignitaries on the dais and off the dais. Today's topic, I got up in the morning and I thought I'll just go through some slides and I'll prepare my topic for today. I started TV and I was seeing a news channel today. And I was very shocked to see what I was seeing on the TV. In Delhi, yesterday, one young girl was taken to a hospital to the giddiness. Doctor on duty, lady doctor on duty gave her some 2 tablets. That girl went back. After about 6 to 7 hours, she was not feeling well. So mother and the brother got her to the hospital again. The same lady doctor on duty gave her some injections. Yesterday's story. And 7 minutes later the girl died. Young girl, 14-year-old, just come from the school. And there was a very big fight in the hospital between the relatives and a lady doctor. Lady doctor started accusing relatives that you given poison and you killed her. Relatives started saying that you killed with your wrong medicine and injection. Police came and there was a very big fight. Now, where was the problem? Problem in this entire situation is not doctor's fault, not the relative's fault. The fault lies with effective medical communication skills. Half of the problem in today's medicine, if you see, almost about 80 to 90% of medical legal cases today against doctors are only because of one thing, lack of communication between doctor, patient and relations. If you do not communicate well with the patient and relatives, you end up in a problem somewhere. Because today, people's expectations have gone very, very high. People are saying that we are paying bills through our nose and we expect the same quality of treatment when we pay the bills. So what are the 4 basic skills which you require when you communicate with the people, whether it's a medical or non-medical field? The first and foremost is listening. Second is speaking, reading and writing. Out of these 4, the first 2 are very important. People write volumes about speaking, reading and writing, but nobody teaches how to listen. And I'm going to teach you today. And your communication skill as a doctor is doctor and patient relatives, 1. Doctor and nurses, 2. And doctor communication is also very important. But before we start communicating with other people, you must identify yourself. What is your nature? How do you communicate? What is your personality? Your basic personality plays very important role when you communicate with the people. There are 3 types of personality when you communicate. First is aggressive type, a passive type and an assertive type. What are the characteristics of these 3 features? The first, aggressive type, is very dominating. Everyone should be like me. I am never wrong and I have rights, but you don't have rights. He is a close-minded person. He is a very poor listener. You don't talk too much, you just keep quiet. The moment you're talking, he'll stop you. It's like your professors in your college. And he always has a difficulty in seeing other person's point of view. He will never accept whatever point you say, he'll never accept that. He'll always interrupt you. He'll monopolize the entire situation. He wants to achieve his goals, often at the expense of other people. He's very dominating, very sarcastic at times. He puts other people down, does not even think that he is wrong ever. He moves into other person's space and overpowers them. He pushes people around him. I know it all attitude, and he does not appreciate other people around him. And when he talks to other person, he points his finger, he moves his finger, he moves his head. He stares very sarcastically, is very critical, very rigid in his postures, and he speaks very fast. And when he talks to you, you must do it. Don't ask me, just do it, I'm telling you. And they are available. Now, this kind of person generates anger, hostility, frustrations, and impatience. And what are the effects on the other person? When this person is around in the surrounding, what is the effect on another person? The effect on another person is he provokes counter-aggressions. That means the opposite person is humiliated and angry from inside. This person wastes too much time and energy spying on other people, seeing what other people are doing, rather than doing some concrete work. And he pays a very high price in human relations. Nobody likes him. As long as he is the head of the department or he is the dean of the institute, people will respect him. The moment he goes out of his chair, nobody will bother about him. And this person can get people together, but most of the time with resentment. People don't like him. Second is the passive personality. Passive personality, well, I can express my feelings, you know. I don't disagree with people. No, you're right. Maybe, no, I don't know. You're right, you know. And Others have more right than me. No, I can't say. He's better than me. I can't talk, And he's always indirect. He wants to tell this person, he talks to this person first. He doesn't tell this person directly. He always agrees with everyone. Always. And he doesn't speak. When you ask him to speak, no, I have nothing to say. You already say everything. And if you see him, he's very apologetic every time. He's very self-conscious. He trusts other person, but not himself. In a given situation, what medicine should I give? Should I give amphetamine this? No, you give. I don't want to give. He does not express himself, and he cannot take decisions for himself. And he sits on the fence on both the sides to avoid conflict. He asks for permission every time. Sir, can I go, sir? Sir, if you don't mind, sir. So may I, sir, if you don't mind, please go. He has difficulty in implementing plans. And when you ask person, you see this person, passive person, he always agrees with you. Keep nodding it there. And he lacks special expressions. He is very low volume when you ask him. He speaks very fast when he is nervous or when he is doubtful, like the most of the students answering exams. They fumble. Like one does not know what is answering. And when you talk to him, no, you do it. You are better than me. No, I can't do it. No, I think you do. I'll try. See, I am not confident, but I'll try coming and talking here. I'm not sure, but and he's got a monotonous voice. And when you ask him to solve some problems, he cannot solve any problem. He postpones everything. I'll see you tomorrow. I'll meet you tomorrow. Or he agrees with everyone around. He is very powerless. He cannot identify other person's fault also. And what is the effect of this person? This person affects, he has a dependency relation. He depends upon everyone around him. He loses his self-esteem. And he is not very well linked with the people. And the third type we have, when you communicate with other people, assertive type. He believes in himself. And he believes that other people are also valuable. Point number one. He knows things very well. He has his own rights, and others also have rights to implement their own plans. He's very effective. He's a very active listener. He listens very carefully. He observes. He states, but he does not label. He's not judgmental. He expresses directly and is a very honest person. And if you see him, he's confident, he's self-aware, he's open, he's flexible, he's playful, he's got a good sense of humor, he's very decisive, he's proactive. He invites questions and answers. And if you see him, he's very firm when he deals with the people. He's action-oriented, he's consistent in his approach, he does not change too much. And if you see him, he's very direct eye-to-eye contact. One, he's very relaxed and a confident postures. And his speech varies, his volume of the speech varies, and he's very confident when he speaks. And when you talk to him, he says, well, I choose to do this. I would have done this in this particular situation. Or, what are my options? What am I supposed to do? And what alternatives do we have? Can we do something better than this? He always asks questions, but in a positive manner. And if you see, any problematic situation, he negotiates, he bargains, he trades off, he compromises. But he controls the problem where the problem begins. He does not wait till the problem becomes very big. He's even-tempered. He does not lose his temper very much. And he has a self-esteem, self-confidence, and he generates the same thing in the opposite person. Opposite person also feels good. So when you have these three types, obviously you know the third type is best, the assertive type is very best. That does not mean the other two types are also very bad. At a given time, a person can be one type or other. About 25% remains the same type all throughout, but 60 to 70% people do change from time to time. What are the advantages of aggressive personality? You have an aggressive personality, it's bad most of the time, but sometimes it is very good. A person has got into cardiorespiratory arrest, and you are a passive person around. Sister, excuse me, if you don't mind, can I get the adrenaline injection? Okay, you are busy, ask some other sister to come. Okay, you are not busy, okay, I'll go and get it. That time you are the aggressive person. Sister, come here. Okay, you get ambush bag. You pass endotracheal tube. You start this. You start IV drip. Okay, call anesthetic. Call this. You require aggressive person who takes the judgment and decision very fast. Somebody is bleeding, massive bleeding from the GI tract. I say, should we give pantoprazole or should we give ranitidine? The passive person. The aggressive person start injection, early pressing, 10 ml, 10 ml, stat, give this, you person start transferring to OT. Aggressive person is very good that time. A passive person is not required. But when you require a passive person you require when you see management, when you see authorities in the hospital, when you go to government for certain things. So like you are in a problem, 2 days you did not go to your college and your dean of the hospital or head of the department has called you. And you say, I had temperature, so what? Everybody has temperature. Don't do that. Be passive. Yes, sir. Yes, sir. Yes, sir, I'm at fault. So that's a passive personality. Passive personality you require when the opposite person's power is better than your power. Be passive. Don't argue that time. Or you are dealing with the management or the government. There's no point in arguing. They're going to all points charted out. So you can argue with them. But you must remember that whichever communication skill you have, you must tune it time to time to become better every time and to achieve the success in medical or your personal life. This is one type of communication. Second type of communication, every speech has got two parts, I and you. There are always two parts of every communication, I message and you message. I message is way of saying that, well, I feel this way, I would have said this or I like this way. And you message, you did this, why did you do this? You're not supposed to do this, don't touch here. Correct. So now, what are the examples of I message and you message? You message is, you stupid fool, you foolish person, you change the TV channel, it's my turn now, I'm going to change the channel now. That's the you message. I message, look, I don't like it when you do this, I wanted to see this program, but if you want to change channel, please ask me before you change, please. So that's the I message and that's the you message. I message has got three basic points. And if you understand these three basic points of I message, I feel, when you, I want. The three basic messages of I message. I feel disappointed when you cancel our plan last minute and you did not even inform me. I want you to inform me next time when you do this. Correct? So, you stupid, you cancel the program, you did everything, you ruined my life, you ruined everything, you ruined my evening. Don't do that. You are fighting. You are very aggressive. Well, next time please don't do this. Please inform me, I get very disappointed when you do this. That's the I message. The I message is the fourth part. The fourth part of the I message you should not practice. The because of I message. The because of I message says that I feel disappointed when you cancelled our meeting last minute. I had nothing else to do and you ruined my evening, you ruined my program, you ruined an entire evening event. Don't say that. The because part is you're blaming other person, you're hurting him, you're starting sarcastic comments. Don't start the fourth part of the I message. Stick to only first three points that will really give you a good control over the communication. When you communicate with anyone, patient or patient relatives, you have to be very careful what you talk, when you talk and how you talk. Because when you are awake, 70 to 80% of daily time, of the daytime, we spend in communicating in some form. And 45% of this time, you are listening and talking, reading, writing, the books written on that. But nobody teaches you how to listen. How to listen to the other person. That's the most important part of the communication. The effective listening requires 3 points. You have to be attentive, you have to be patient to hear him, and you have to suppress your urge to control the discussion. Okay, you cut short. Don't do that when you're listening. There are 10 bad listening habits, and each of these can be very harmful to you and your patient's relations. First is dismissing the subject as uninteresting. Patient is telling you, is got abdominal pain, that is saying, Doctor, when I was operated in 1986, Okay, don't tell me about that. Doctor, when I had headache, I did my citizen. I know, don't tell me about that. Don't do that. Let him speak what he wants to say, because they may have some point to prove. Don't pretend that you are listening. Most of us do that. We are very good in medical with sleep with eyes open. and how to sleep with eyes open, you all learn in your second and third MBBS and first MBBS. After lunch, After lunch, you had your dabba and heavy lunch. You go for the first lecture, pharmac lecture in afternoon. and you are listening to autonomic nervous system lecture in the post lunch, and you are in a first bench, and the professor, head of the department, is taking the lecture. You have no choice but to keep your eyes open, smile on the face, and sleep. And when you learn this, you practice the same thing with your patient. Patient is telling you, doctor, no, एक बार मुझे बुखार आया था, I had a temperature, no, what happened that time? We are already thinking about today evening, I'm going for the movie, which movie I'll go. So mind you are thinking something else, but barabar hai, it's very good. Third, avoiding difficult materials. There are certain points patient is saying, you don't want to talk about that, and you minus that. The fourth point is very important, which we all experience today. The fourth point is distraction. When you're talking to the patient, you're listening to him, you get distracted in your clinic, in your hospital, by the people around, people moving and walking in and out, or nowadays mobile phone ringing. Correct? Now talking to patient, now see the situation I'm telling you, you're in ICU, I've got a patient in ICU who's very serious, who's about to die, say 4-6 hours, that is going to die. I come out, I'm talking to the patient relative, and I'm saying that she is very serious, you know, I don't know, maybe 6-7 hours, maybe tomorrow, and suddenly my mobile phone rings, then see what I talk on my mobile phone. Oh, hi, there's a party today. Where's the party? Oh, fantastic. Taj, over there. Oh, I'd love to come to Taj. You know, good food, you know, dancing. Oh, I love dancing. Now see, this person is dying there. And on my mobile, I'm talking about a party in the evening. So I have no respect for the other person's feeling. You understand this point? When somebody is serious, I'm talking about a very serious point, life and death, which is not in my control, and at the same time, on the mobile, I'm talking about party and dancing tonight. Please, you have any of this kind of phone, immediately switch off the phone. Say, I'll talk to you later, I'm an emergency, switch off the mobile phone. Control your discussion, discuss everything with the relative. Now remember one important point in your discussion with the relatives, the ICU patient inside, very serious. Most of the doctors, they avoid meeting relatives outside the ICU because they do not want to face the fact that patient is serious, is going to die in some time. Your strong point, you go outside, you sit with the relatives, sit on the chair, take a paper and pen and start discussing with the relatives. And discuss in the language they understand and language they speak, you discuss in that. And now what is important that you go outside and say, look, here's a cirrhosis of liver, here's GI, 3 days continuous septicemia, here's a gram-negative septicemia. And the person from the interior of India, village, what does he understand of cirrhosis of liver and GI bleed and variceal bleed? So you have to talk in the non-medical terms and sit down. If you are standing, okay, both serious hai, aapka patient both serious hai, you can't do that. You have to give time to these people. They are looking at you. We say that doctors are like God. After the God, you know, doctors are there in this earth. And this person who's dying, relatives are looking at you, there was some hope in their eyes. Maybe something doctor will start and this patient will survive. And at the same time, you are very rude, your body language is very rude, you don't talk to them nicely, don't do that. Sit down, draw a diagram of liver, draw kidney, draw heart. देखो उनका liver खराब है, and because of the liver, kidney भी काम नहीं कर रही है, and उनका heart में भी problem आ गया है, ये infection की वजह से, infection कभी भी लग सकता है. Talk something in a language they understand, and that will give you rewards. Even if this patient dies, these relatives are very happy. And what is the success of a doctor? A success of a doctor is one. Even after that patient dies, the next day the family is in your clinic with the second patient from the same family. That's the success. Most of the time, when one person dies in the family, the entire family is against the doctor. नहीं वो doctor के पास नहीं जाना है. We don't want to go to that hospital. We lost somebody in the family in that hospital. Oh, we are not happy with the hospital. The patient died. People are not talking to us nicely. So that is the negative point. Your positive point, the same family next day in your clinic with a faith and a hope on the face. No, my doctor is the best in the world. And that is important point. Don't find fault. Problem is relatives mannerism. One patient, 5 relatives, everybody comes in your clinic, and some is very hostile, some is very angry, they have to wait outside in your clinic. Don't look at the relatives' behavior. Don't look at somebody frowning at you, somebody is looking there. Be very kind, greet them, let them sit down. don't find faults with the patient's relative. Otherwise what happens, sometimes relatives come and they make some comment, Doctor साहब 2 घंटा बिठाया, साहब हमारा तो पूरा picture देख के हो गया. You don't say, I'm a human being too, I'm also working since morning, don't do that. I'm very sorry, next time this will not happen. In your one sentence, you have won that person. By trying to prove your point, I'm also a human being, you are starting criticism, you are starting argument. I'm very sorry, next time this will not happen. You are at fault. Patient is really not at fault. Accept your fault. That's the most important part. When you can accept your fault in any communication, you're the best person to communicate with. Second thing, when you're listening, don't be like an American doctor. American doctor, well, my 43% of cases have this, and about 12% of cases have this complication, and 7% cases are good, and my 98% patients recover. Don't talk like this. You ask patients relative, घर में कौन-कौन है? Who's there in your family? My mother, my brother, sister. Acha, what about father? Person starts crying. My father died. So you are very inhuman. Oh, your father died? Okay. Who else is there? You are not even looking at the person's face. That person is crying. You are not putting facts and figure on the paper. You have to pause, you have to wait, look at that person. Don't do anything else. You don't have to give lectures to them. Just get up, put your hand around him, or just hold that person's hand. Okay, I'm very sorry. Okay, fine. Okay, just lie down, I'll talk to you 2 minutes later. That you do it, that is better than, Acha, Padama ka kaise mar gaya? Very bad attitude, don't do that. Okay, next point. Patient relative making very strong sentence, don't listen to that. Don't write down notes. Patient is talking. पेट में दुखता है. कभी से दुखता है? Okay, headache. कभी से headache? What is the headache? Don't write down. You keep a paper and pen with you. Okay. Headache, 2 years. Abdominal pain, 3 years. Just write down points on a paper. Don't start writing down everything without looking at the patient's face. Because you're losing eye-to-eye contact with the patient, which is the most important part. And the most interesting point you will see, any person can speak 110 to 150 words per minute, on average about 125 words per minute. But your mind can assimilate 500 words per minute. So you have a gap of 375 words, extra space you have in your mind. The person has spoken only 125 words. You have a 375 words space still in your mind at a time. So what people do? They start thinking something else. Don't do that. This extra time you have when you're talking to the person, use it to assimilate and think what you're going to ask next, rather than thinking about your program in the evening. Because you lose contact with the patient otherwise. So how to improve your listening skills? There's all the bad points. How do you improve yourself? Give feedback. Acha, okay, you had a pain. You told me you were admitted. When were you admitted in hospital? That one question is enough for the patient. My doctor is listening to me. Second, don't remain silent, physically and mentally. The person is talking, you have no reaction on your body, face, and no asking questions. Patients don't like it. Ask questions, listen to them. Your eyes, most powerful point. Your body language, most powerful. So examine, see the patient's body language. I'll tell you a simple point. When you examine, when I examine a patient's abdominal pain, a boy or a lady comes with severe abdominal pain, I'm examining. In 10 seconds I come to know this is malingering, this is a false or a true genuine case. When you examine abdomen, just see the one important point. When you press abdomen, what a hysterical person does, closes the eye, turns the face to the opposite side and a smile on the face. Sab bahut dukta hai, sab bahut dukta hai. That is a functional. And the organic patient, oh, this doctor is paining. He's looking at you. That person learns to the opposite side, sees the other side. Now, doctor's confidence and experience, you can see in a voice. When doctor talks, you can see that. So the most important part, when you talk, your voice has to be 2 minutes, please. Okay. You pause when you talk to the relatives. Pause outside the ICU. Don't give a complex message too fast. Your patient is very serious. Say, he's got infection. There's a very bad infection in the blood. You have to be very careful. We change the antibiotic. You have any questions to ask? Please ask me. Do that. Second thing, use words very appropriately. Some people say, देखो, आपका gallbladder खराब है, मैं काट डालूंगा. मैं काट डालूंगा, I'll cut it. The person feels pain before even you touch him. Or don't use the very complex. Well, you got acute and chronic cholecystitis, you got calculus cholecystitis. I may have to excise your gallbladder and make you the CBD behind. He doesn't understand what you're saying. तब उसका मतलब क्या होगा? तो just say, see, आपका gallbladder disease है, मुझे निकालना पड़ेगा, हम क्या करेंगे? देखेंगे, फिर निकाल देंगे. Don't say I'm going to cut it. Sounds very bad. Okay. Next important point, when you communicate with your friends and doctors and sisters, please communicate very clearly. Provide a very complete information. Like today morning somebody had a reaction to the medicine. When you're going off the duty, please tell the doctor that I gave Perinom injection to the reaction. Other the same doctor on duty, you give another injection Perinom, patient will have more complications. Write clear notes on the paper, write detailed findings, and communicate with the staff nurses very clearly. One very big hospital in Bombay, 3 years back, young child admitted with convulsions. Doctor on a telephone in his clinic, he told sister on duty, sister, dilantin syrup de do. Sister gave dilantin syrup. Now dilantin is metronidazole syrup and dilantin is phenytoin. Sister gave dilantin, patient died. The young child died. Same evening. Whose fault? Doctor's fault. Doctor did not make sure that what is the spelling sister has written. Sister has understood, not understood, and he did not say the generic name of the medicine, which he should have done. So, few important message today's thing, where the maximum medical legal cases occur. Maximum medical legal cases occur because of my action in your action. See how it occurs. You make a very critical statement about other doctors' treatment. Well, this doctor really missed your diagnosis. You know, I wish he had picked up earlier. But probably you do that. So, acha, doctor missed the diagnosis. They're angry, relatives are angry. Almost 20-30% cases are because of the doctor's wrong comments. Second, don't get your ego into the treatment. You believe in certain treatment, the other doctor's got other treatment, don't criticize him. That is his viewpoint. I would like to treat this way. Say that. Second thing, when you see somebody's surgical scar, one surgeon sees other person's surgical scar, what he does? He has not said anything. His doctor has not said anything. He looks at the scar. Don't do this. Don't do this. You have no right to criticize other person. Even if the person is wrong, please keep silent, but don't criticize. And second thing, accept your faults. If the surgery has been done, stones have remained in the gallbladder, the first person who is supposed to know is a patient. You go and tell the patient, look, I've done a surgery, the stones are still in the CBT, I'll have to remove it, don't worry, I'll take 1 day. You don't hide it from the patient the facts of the medicine. So conclusion of my today's talk, when you display personal attributes of compassion, honesty and integrity in relations with the patients, family and communities and medical professions, you must keep that. Exhibit appropriate value for the sensitive nature of the doctor and patient relations and the importance of the communications. You must communicate well. Demonstrate professional and high ethical standards in maintaining the medical practice, especially in the competence, honesty, integrity, respect for the others, professional and social responsibility. Demonstrate social awareness. Demonstrate awareness of the unique health care for the ethically diverse communities. And do good medical practice. Every doctor must be professionally competent, must perform consistently well all the time, must practice ethically, do patients no harm, be an effective team player, work in a team, and take action if the poor practice is putting patients at risk. And make sure that you do good medical practice. Thank you very much.
Thank you so much, Dr. Chetan Bhatt. मैं निवेदन करूंगा डॉक्टर जिवराज शाह और डॉक्टर बेगानी जी से कि वो मंच पर आए. And a small token of appreciation from our side, certificate. Small token of appreciation, Dr. Chetan Bhatt, and I would request you to please give him a big hand. Next, I call upon Dr. Bipin Doshi, a senior family physician, A big round of applause for him.